Dr. Quinn, the last few months have been hard on Americans. Many of us are sad, others of us are furious. Is it safe to say that we're all a little bit on edge?
Andrew, I've had so many patients lately that have come in with a lot of anxiety, a lot of emotions, and in an attempt to try to make them feel better, I've revealed that I too am having a lot of anxiety. And the bottom line is I've had a lot of sadness, I've had a lot of anger, I've had a lot of worry, I've had a lot of fear. And Andrew, I've also had a lot of disappointment. But what I tell my patients, and I tell myself, due to all the terrible, horrible things that are going on right now in our world, it's understandable. And Andrew, it's okay.
You know, Dr. Quinn, I do have a tendency to hide behind a smile. How important is it to actually talk about your feelings with somebody?
Andrew, you cannot imagine how important this is. I mean, there's been so much research over the years that have demonstrated individuals who keep all that emotion just bottled up and smile and pretend that everything is okay when it's not. Well, this can actually have a lot of negative consequences physically and psychologically. The research has shown that with built up anxiety and frustration, not letting it out, individuals have a higher chance of having a higher heart rate, a higher blood pressure, higher blood glucose levels, which could put that person at a higher risk of having a stroke or heart attack. And psychologically, a lot of individuals have underlying depression and anxiety, and just keeping all that bottled up can cause an exacerbation, and it could even cause someone to lose their life. That's why it's so important that individuals talk about it, seek treatment when needed, because it could be the difference between life and death in some cases.
Now, who should we talk to? Co-workers, spouses, trained professionals? Who's a good sounding board for us?
Well, it just depends on how severe your case is. If you're an individual with a little bit of frustration, maybe talking to family and friends for a start. But if you find yourself feeling overwhelmed, it's a good idea to go ahead and start with a medical professional, such as a primary care physician, such as myself. And as I assess patients very recently lately, I'll assess them in a very professional manner and make a very thorough evaluation. And some I refer them to a therapist, psychologist, and some I'll even refer to a psychiatrist. But at the end of the day, I tell people that it's a good idea, and don't be like a patient a couple of weeks ago who told me he's not crazy. And I explained to him, it's not being crazy. That's not even what he is. I said, what you are, sir, is you are intelligent because you're seeking treatment, you're going to get help, and you're going to get better.
And Doc, quickly, can you tell us about turning these powerful emotions into something positive? You have something planned, don't you?
Most definitely. On this Sunday night, June the 7th, what we advise individuals to do is take the pain and turn it into something positive, something bigger than ourselves. And at New Horizon Church, June the 7th at 5:30 in the parking lot, practicing social distancing, being responsible with masks, they're going to have an assembly of men. It's called a solemn gathering for all men. And I talked to Bishop Crudup, and he said the whole theme is we must build and not burn our community. And that's just positive with that energy, and that's what we need to do.
Absolutely. Dr. Timothy Quinn, thank you for spending a little time with us. Very important topic today. You're watching 12 News at Noon.